like to call to order the City of Lakewood study session, virtual meeting on April 6th at 7 p.m. Will the clerk please call the roll? Go ahead.
Paul,
Here.
Abel,
Hold on. I'm going to unmute everyone.
Thank you. Here.
Vincent,
Here.
Gutwein,
Here.
Vita,
Here.
Gilling,
Here.
Springsteen, Franks,
Here.
Johnson,
Here.
LeBure,
Here.
Harrison. You have a quorum.
Well, thank you all for taking the time to tune in this evening, and certainly a challenging time as we continue to work through all that's happening in our country and in the world. I would like to make a couple notes. We will have an update on our previous workshop meeting during our general comment time. But I would also like to mention for folks that are tuning in, item 4, presentation discussion on the future of metro districts. That has been changed. It is now going to be put out. There'll be a presentation that will be done by Jay Hutchison, our Public Works Director. And we will take that up a little bit further down the road when we can have public participation in that subject. So without further ado, I'm going to go into our item number 3, which is a presentation and a discussion. We're very honored tonight to have Dr. Mark Johnson, who's the Executive Director of the Jefferson County Public Health Department, who has certainly probably been working 24/7 for the last few weeks, him and his team, and are experts on all things COVID-19, and actually during the state of emergency are actually the guiding agency for the first stay-at-home order that was then superseded by the state of Colorado. But Dr. Johnson, I just want to thank you for taking the time to be here. I know that this has been a challenging time for you and your folks as well, and just turn it over to you.
Thank you, Mayor Paul. I appreciate your kind words. Our staff have been very busy, but I would also like to deflect that honor and praise to those on the front line in our hospitals who are facing death every day, much more than we are, even though we're very busy. Thank you. I'm not sure exactly what all you would be best for me to cover, but I thought I would cover about 5 different areas, talk a little bit about the virus itself, talk a little bit about testing and some of the problems we have had with testing, talk a little bit about treatments for COVID-19, update you a bit on the cases and deaths in the state and in Jefferson County, then just mention some of the issues that we're having with the stay-at-home order, and then open it up for questions and answers if that is acceptable to you. The virus, unfortunately, is a virus that we have never seen before in humans in this world. It apparently came from bats mixing with other wild animals in what are called wet markets in China, where numerous animals that in the wild would never be close to each other are put in cages that are very close to each other so that they share the same breath. They have urine and feces that commingles with each other. And so they are exposed to viruses that they would never be exposed to in the wild. What this does then is bring new viruses, and occasionally some of these are infectious in humans. And that is what we have with this new coronavirus, which is called the SARS-CoV-2 virus, and it causes the disease COVID-19. As you know, there is no immunity because, as I mentioned, it has not been seen before, and we do not have a vaccine for it. We also don't have very good treatment. In fact, we don't have any real treatment for this that has been substantiated. We have tried numerous antiviral medications because it is a virus like some of the others that antivirals do work with. We also have tried some rather unique medications. One of them is an anti-malarial medication that is used for lupus also, called hydroxychloroquine, and then an antibiotic called azithromycin. In some small studies, these have been shown to be very effective. In other studies, they have not seemed to help much. So it's hard to say whether they are effective or not, or if there may be a subset of individuals in whom they are effective, but study is being done on that. One of the questions that was sent to me by the deputy city manager that I believe one of the council members raised was, what about what's called convalescent plasma therapy? What this is you find people who have been cases with the disease who have recovered and now have antibodies in their plasma to the virus. And what happens then is you take the plasma from those individuals and you inject it into somebody who is usually severely sick. You don't use it on the mildly sick, but you use it on the severely ill. And what this does then is give them somebody else's antibodies to help them fight the virus. And in, again, some small studies, this has been rather rewarding, and a lot of study is being done on that. For the most part, however, treatment is what is called symptomatic treatment. Whatever the symptoms are that a person presents with, you treat those. And one of the most severe is what is called acute respiratory distress syndrome, where the lungs essentially have pneumonia, viral pneumonia on both sides of the lungs, and it closes down the ability for oxygen exchange to happen. And so this is why you are hearing so much about ventilators, because what ventilators do is they force oxygen with a great deal of force into the lungs to help open up those alveoli where the oxygen exchange takes place, and helps to let the patient continue to breathe even though they don't have the power on their own to get air into the lungs. Testing has been a problem. America decided to go on its own instead of using the World Health Organization test. I was not privy to the discussions that led to that decision, but it has been a bit of a fiasco in many cases. First of all, the testing reagents that were sent out were faulty, and then we have had a hard time keeping up ever since then, getting both the reagent out as well as the swabs that are needed for the testing, and then finding laboratories that have the ability to do the test once they get the swabs from the case or the patient that is presenting. Hopefully we can see a light at the end of the tunnel. We now have more than just the state laboratory here doing the test. We have a number of the hospitals doing these tests. We also have private laboratories that are doing tests, and we are getting new testing modalities so that there are some quicker tests with turnarounds and some new tests that are coming out. The test that is being done now basically looks for viral particles in the nasal swab to see if you have the virus that is, or particles of the virus that is the coronavirus. What is being done now is there has been one FDA approval of what is called an antibody test or a serous test, where you can take a prick of blood and put it onto a medium that will quickly show whether you have antibodies to the coronavirus. There are basically two kinds of antibodies that show up, one that shows up rather quickly and then one that shows up later, which shows that you have had the virus and that your body has been able to fight it off with these antibodies. That now should be being dispersed around the country, and hopefully we'll have both more tests available, more sites available, and more kinds of tests available to do the testing. This is very important when we are looking particularly at our first responders, because if the responder is exposed to somebody who does test positive, what we are having to do now is put them in quarantine for 14 days to see if they come down with the infection, because the incubation period is about 14 days, or at least the long time incubation period seems to be about 14 days. And so this takes people off of line, both for fire and for police and for other first responders, when they may not need to have this. So if we can test them quickly and find out whether or not they are have been infected with the virus, we can get them hopefully back into service quicker once we have these tests available. As far as cases and deaths in Colorado, as of yesterday, we have had 5,172 cases with 150 deaths. In Jefferson County, we have had 561 cases with 19 deaths. In the country, we have had over 300,000 cases and over 10,000 deaths. I don't have the exact numbers for those tonight. Once we initially were trying to figure out the disease and how it was being spread, and that continued to change. Initially, we thought that when somebody was asymptomatic, they were not contagious. We have learned, however, that for 2 or 3 days before somebody shows symptoms of the disease, they can be contagious. We also thought that the main spread or the only spread of the disease was through droplets. We're now learning that it can be aerosolized, which theoretically are just very, very small droplets, but they can last in the air much longer than the larger droplets, which usually fall onto the surfaces around them. So with these small aerosolized particles, they can be breathed in a room where somebody who has been infective may have been hours or minutes before you are even in the room. So we're learning more about how it's transmitted. We're learning more about what it can cause. Initially, we thought most of the disease was severe respiratory infection with high cases with cardiac complications. So we're learning more about the virus. We're learning much more about how it's transmitted, and all of this has changed our response to the virus and some of the public health orders that have gone out. One of the best things that we have found around the world is what are called stay-at-home orders, or sheltering in place, or lockdown, or whatever you want to call it. Basically trying to keep people out of the public as much as possible, and when they are in the public, keeping them separated as much as possible. And now, as you know, we are also encouraging people to wear masks if they are in public to help decrease both their spread and their chances of getting infected. All of this has caused a lot of concern, because when you put a stay-at-home order in place, you also have to determine who are those who are what are called critical workers or essential workers or essential businesses. What are those places that need to be left open so that services can continue to provide critical services or essential services? The choice of those is very difficult. At times they have been tainted maybe with some politics, but we have tried in all of the ones that we have suggested to look at what is the best for the public health and tried to limit it to there. However, I think probably for the last 5 days, most of my time has been spent responding to complaints on compliance or complaints on what is essential and what is not essential. And we have been working with the governor's office and with the state health department to try to get more clarification as to exactly what is meant by the governor's order. As you mentioned, we did have an order ready to go before the governor put his in place, but to help decrease complications and confusions, all of the Denver Metro health departments have adopted the governor's stay-at-home orders. And so we continue to work with him, his office, and the state health department on some of those issues where there are some confusion, as continues to be some confusion, to get a little clarification on that. That essentially is the situation we have, Mayor Paul. I would be happy to try to answer any questions that the council members have that may be more specific or more targeted than what I was able to do in just the presentation, as sort of a general presentation.
I had muted myself, so still trying to learn how this all works, and would like to open it up to council now for some questions related to it. And I do want to just hone in on one comment that you made too, really, and that was your thanks for all the folks, our frontline workers and the first responders and the doctors and nurses. And thank God for all of them and what they're doing. and also the challenge you were up against with the different, I would say, constituencies when you were looking at how do you do an order and what is essential and what's not. And I know that certainly was not easy, as you were certainly probably being lobbied by a lot of different people. So with that, I'm going to go to Anita first. Let me get you unmuted. There you go.
Thank you, Doctor, for your presentation. Just a couple questions. How long have we known about this specific strain of coronavirus? And also you made mention that essential businesses and what is considered that has been tainted by politics. And I'm curious what you meant by that and how it's been tainted and how we decide on those essential businesses. Thank you, Doctor.
Thank you very much, Council Member. Let me start with how long have we known about the strains? Actually, we are learning more about the strains all the time. It appears that initially there were 2 strains in China with various names that are not important, but one that seemed to be a bit more infective and more serious, and one that seemed to be a bit less. Now we know there are at least 8 strains that have been identified around the world. One of the huge problems with viruses, as I sort of mentioned at the very beginning with bats and animals, is that once these viruses get into other species or even in a same species, they mutate. And when they mutate, they then may become more infective, or if you do have immunity to one strain, you may not have immunity to another strain. This is the problem we face every year with influenza, where the influenza virus can either shift or drift, either make a huge change or a minor change every year. And when that happens, we have to adjust the vaccine that we have for it, and we end up either having a large influenza outbreak or a small influenza outbreak. Coronaviruses are in many ways similar to that, and we are learning, as you probably know, one of the coronaviruses is the common cold. And every year, some people get a cold again because a little bit of change in the coronavirus that causes colds gets by the immunity that somebody may have built up. That's what we're trying to figure out with this virus, is how many strains, how much is it mutating, how is it causing antibodies? Are those antibodies still good against the different strains? So there's a lot about that. I probably should not have said anything about the politics. I don't mean it in a party kind of politics or even in a political sense, but that people are politicking all the time for being included on the exempt list instead of being included on the list that's being closed. And so taking that into consideration does make changes. One of the most obvious was when the city of Denver first put out their list, they had excluded liquor stores and marijuana dispensaries. And then there was a huge rush on the stores before the order went into place. This raised 2 concerns. One was a public health concern, and one was more of the general politics, I guess, of what's going on. But the concern of 2 things. Number one, the exposure of people in long lines, and then also the rising concern about what are we going to do in our hospitals if people who may be addicted to alcohol or addicted to marijuana begin to have symptoms of being away from the drugs and more problems. So that was one of the sort of political decisions that was made. And there have been more minor changes variously as we look at how do we ensure that we keep that separation of space, and how does that impact some of the essential businesses that we have on the list.
Anita, is that sum that up for you?
I think so. I don't think I quite understood how long we've actually known about the virus. I sort of understand the origins in China, but I wonder if you have any take on that, the length of time that we've known.
We have known about the virus since November, December era in China. We think that probably it was circulating in China several months at least before that, either without being identified or because the government did not want to let the world know about it. There are still issues around that. So as far as the virus itself, it has appeared only in the last 5 or 6 months. The different strains, though, continue to change. And so each of those different strains we have known about for a different length of time. But as for the virus itself, we didn't know anything about it before November of 2019.
Okay, I have Dana, Ramey, and then David.
Oh, can you hear me?
Yes.
Yep.
Okay. Oh, I'm sorry. Thank you. Thank you so much for your time, Dr. Johnson. I really appreciate you being here and providing this update. I don't know if you have this information, but I was wondering about if you have any information about the specifics in Lakewood in terms of how is the capacity at our hospitals right now? How is their the status of how much PPE they have and the equipment that they need, and that kind of thing. I know we get updates about statewide needs, but I was wondering if you have any information about how our Lakewood hospitals are doing.
I don't have a specific patient count right now, nor do I have a count for how many COVID-19 cases they have in the hospital here in Lakewood. I do know that the emergency rooms are being overwhelmed with people with symptoms, and that all of the hospitals in Colorado, particularly in the metro area, are not equipped with all of the PPE that they feel they need, and that ventilators are becoming in short supply in certain areas, mainly here in the metro region. I don't know specifically about the hospital in Lakewood, what their current need is for ventilators, but I do know they continue to ask for personal protective equipment, particularly N95 masks and face shields. We have plenty of gloves, it appears, but as far as the gowns and the masks and the face shields, those are all in short supply, particularly what is called the N95 mask, which is the one that protects you the most from the virus. We have had now 3 shipments from the Strategic National Stockpile, the federal stockpile of this protective equipment, and it appears that's going to be the last shipment we get from there. We have a list of both hospitals as well as skilled nursing facilities, long-term care facilities, home health care facilities, all of the kinds of facilities that are dealing with patients who are at risk, asking for more protective, personal protective equipment. We are beginning to search for other possibilities where we may be able to purchase this. Unfortunately, this is not being coordinated well, so we end up competing with other counties and with other states, which drives up the cost of all of this. We are trying to find as much as we can, where can we find this? One of the problems in a time like this is you begin to find people from all over the country sending you information about how they have a special avenue into getting this protective equipment, and many of those are fraudulent. So again, trying to figure out exactly who are the best purveyors, the vendors that we can trust, and how readily are they really going to be able to get this is also an issue. But in the Emergency Operations Center here in Jefferson County, the Office of Emergency Management, as well as our incident command are working as hard as we can to find those. Much of that has gone to Lutheran Hospital and to St. Anthony's Hospital. And then we're also trying to give some to those smaller agencies that are searching for it. But it is a major problem because not only are we looking for it, every state is looking for it, and every country in the world is looking for it. And so it is a huge problem.
Thank you.
So I have Ramey, Dave, and Jacob.
Thank you. Thank you, Dr. Johnson. I've known you for years, and watching you speak, I can see that the weight of this situation is pretty heavy on you right now. I know that you're working 24/7, frankly. I have all the respect and admiration in the world for you, but I just need to have a little bit of understanding on something. You have on your website an online form that folks can use to report suspicions of violations of the stay-at-home order. And you alluded to that you are spending a lot of time with complaints. Couple things. Could you please tell me or tell us all about how many reports you've already gotten? Because I don't think it's been up that long. What is the penalty for someone that is violating this? And basically, who's following up with that? And is there any way to screen if a complaint is arbitrary by another neighbor? Could you please respond?
Hold on, doctor. I might have muted you. 1 second. No, yep, go ahead.
Okay. Thank you very much, Council Member Johnson, for your kind words. As far as the enforcement, this is a problem we are having around the state, actually, with each of the different county health departments trying to figure out the best way to do this. Our initial plan and hope was that most people would be compliant and would understand the need for the stay-at-home and other orders that were put in place, and that they would observe them. And that has been the case. The majority have been doing what we have been asking, and that is a huge help. There have been some areas of confusion, and that has caused some problems. In some of the areas, the public golf courses have been closed, but the private golf courses have stayed open. We sought clarification as to whether golf courses were included in the governor's original public health order. And the answer that we finally got was that golf courses can stay open as long as the clubhouses are closed. They are not supposed to be using golf carts, at least for people who are not from the same residences. And they are supposed to be observing social distancing, hopefully taking out the flag so that people don't have to touch things in common. There's a number of things that they're supposed to be doing. This has raised a lot of concern from neighbors who see people out golfing on private courses, but not on public courses. They think that that is not equitable, and they also have concerns about this being an essential business at all, even though we have been encouraging exercise and some kind of self-care that hopefully this is helping to take care of. But those are the kinds of things that we've had to try to deal with is people reporting those. The form has not been up that long, and I don't know exactly how many forms have been filled out, but I know we've had, before the forms, we've had over 150 calls of people suspicious or concerned about what their neighbors were doing. To some degree, we also rely on that people will help either talk to their neighbors or let us know about their neighbors or other businesses or whatever that they feel may be not keeping in line with the order. We then are lining up our inspectors, our environmental health inspectors, and training some of the the building inspectors in the county to go out and initially just talk to the people, make sure they understand what the orders are, and to try to get them to voluntarily comply. If it is an imminent public health threat, or if there is real recalcitrance, then we are turning to law enforcement, both at the sheriff's level and at the municipality level, to help us enforce that. And there are both monetary fines that can be given, as well as jail time. We hope we never have to do that, but a person can be fined monetarily for breaking a public health order. And at this time, we have not yet had to officially do any of those, but it could happen. I'm not sure I answered all your questions, council member, but I think that was sort of the gist of what you were asking.
Hold on real quick. I think you were on mute, then I muted you. Now you're off. Go ahead.
Thank you, Dr. Johnson. You were speaking about the positive protein or positive plasma for antibodies. When will there be some kind of site that people can go to donate plasma? Is there anything regarding that? And what do you see right now as the city's role to help?
I do not know of any sites right now. It would basically be, you would go to a blood donation site, and they would take your blood, and then they basically put it through the separation and get the plasma out of it. I do not know of any hospitals in Colorado yet who are experimenting with this or who are using it as treatment. That's just my own lack of knowledge. There may be some that are doing that, but basically you would go to a blood donation site, donate your blood. But again, it would only be if you have been certainly positive and then have recovered from the disease that we would be looking for that kind of plasma. As far as the city and what you can do to help, I would begin by thanking all of the municipalities in Jefferson County and the law enforcement agencies in all of the municipalities, as well as the elected officials who have been very interested and very helpful as we have been working through this crisis. I have been trying to keep them updated as to what's going on. And right now, I think the biggest help is for us to be working with your law enforcement as we may need to have that. We have not yet gotten to the point where we may need to talk about some of the maybe perhaps building inspectors and things like that at the municipal level, but we will be in constant touch with the mayor and the city manager as things progress to see if anything like that needs to be done. But I would say that so far all of the cities have been very cooperative and very helpful as we have tried to deal with this.
Thank you. And then one follow-up question. Am I unmuted?
I can hear you.
Okay, one follow-up question. At this point, you're not even really sure if the plasma is being used as a treatment, or is it just a therapy or modality that is basically being looked at in a potential?
There has been a small study out of China with about 7 patients, I believe, and the plasma was used, 5 of them improved. So it's a very, very small study. So what is being done now is at research centers around the world, more study is being done to see if this will be something that is valuable. As I think I mentioned, it would only be used on those cases that are the most critical cases. It would not be used on the average person that had the disease, but only on those who nothing else has helped. Because there are, as you know, as a nurse, there are some complications anytime you do something like this, and you would not want to put anyone at more risk. So I do not know where all of the research is being done. I do not know of any of the hospitals in Colorado that are using that modality at this point yet.
Thank you.
Thank you.
Dave. Let me get you unmuted. You should be good to go.
Thank you, Doctor, for joining us tonight. Can you hear me okay?
Yes, I can. Thank you.
I'll keep it brief. I was going to ask exactly what Counselor Johnson asked about what cities can do right now. So I appreciate your response on that. One other thing I was thinking about, I saw a news report where it was actually a kid that was going around to all the hotels and gathering up, having them donate things that you wouldn't necessarily think of with the shower caps, other gowns, other things like that. Has the county given any thought to, or they probably have, or maybe they haven't, reaching out, county sending out a notice to all of the hotels, whether still operating or not, that that is something that you guys could use? And if not on a county level, is that an example of something that we can do, reaching out to our local folks and seeing if they have things like shower caps that we could give?
Yes, thank
I'll
you.
hang
very
up and listen.
Thank you, Councilman. Both the governor and at the local level, we have groups that are looking at innovative ways of trying to find personal protective equipment and other modalities that might be helpful. I have not heard of this specifically, and I will send this on to our incident command team to think about. We have been doing some rather out of the box kind of thinking, though, looking at what other kinds of businesses may be using masks, whether those are woodworking shops or perhaps cleaning shops, those kinds of things that, or even hair salons and those kinds of things that may be using masks, and would they have the ability to donate some of those, reaching out to dental offices and medical offices that may not be providing critical services right now. So that is very important, and I will certainly add this to our list of things that could be added. And yes, that's something that cities could be reaching out and looking for, working with their businesses and perhaps those that are closed or those that may have materials or other things that could be used for this. So thank you for the suggestion. I will send that on up the line. Thank you.
Jacob?
Yeah, thank you. I guess one of the questions I had, which was sort of in line with Councilwoman Johnson and Councilman Skilling, was about effective measures. I guess my question is more in line with, do we have some sort of uniform recommendations? That way, Arvada is not doing things differently than Lakewood. Like maybe some cities are taping school ground or playground stuff up with caution tape, and other people are just putting up signs. Or do we have some like uniform recommendations that might be helpful for all the cities to sort of help get on the same page, or help make recommendations to companies like Walmart or Safeway for keeping only a certain amount of people in the stores at a time, or that sort of thing?
We do have some common recommendations and common guidelines that we are sending out to all of the municipalities and the law enforcement agencies. However, each individual municipality and government group can look at the way they are doing things and do them a little bit differently. Some cities are closing their parks, some are leaving them open, some are closing the bathrooms in the parks, some are leaving them open. A part of that has to do with the manpower ability that each of the governmental entities may have available. And so there are differences from place to place and from county to county. But as I mentioned earlier, we have tried our best, at least as local public health directors in the Denver metro region, to be as uniform as possible and to send out the same kind of information and recommendations to both the parks and law enforcement and businesses as much as possible. Denver, as you probably know, does have a bit of that home rule attitude that they are different, and occasionally they are doing things a little different, although they did adopt the governor's stay-at-home order, even though the mayor had a different one originally. But again, they are being a little bit more aggressive in enforcement than some of the rest of the counties. And so there are differences across the area that you can pick out, but we are trying to be as uniform as possible, mainly to cut down claims of discrimination or inequity, or to decrease the confusion that the public has as to what you can do and what you can't do.
Thank you. I appreciate that. And I guess my last question would just be, is there a good channel for neighbors or interested parties to give you guys suggestions, like the shower cap thing that we just heard from Councilman Skilling? Is there a good channel for people to reach out to the county to offer up things?
Yes, actually, one of the best would be the website, or an email address, which is health, HEALTH, EPR @jeffco.us. That's basically Health Emergency Preparedness Response. So Health EPR @jeffco.us. Suggestions and ideas can be sent there. They will then be divided out to the planning or logistics or surveillance or epi teams to review those. And that would be one way that information could be sent into our Incident Command Emergency Operations Center easily.
Great, thank you.
Thank you.
So Doctor, I have a couple things. You see, I have my mask here. What are your best recommendations for when people should be utilizing these? Whenever they're out in public, whenever they're interacting with somebody outside their household? That's one. Secondly, we've also heard that there could be a second wave of this coming through, potentially before there's a vaccine. And if there's any truth to that. And then Sharon Vincent, Councilor Vincent, brought up a good point today, and I'm going to bring it to the Food Council tomorrow. Some people don't have access to these masks, period. And you kind of have a have or have not. Some folks might have resources that allow them to either make them or have things. And so a more robust, I guess, effort to get, she had mentioned folks at the bus stop or people who may be, getting food assistance, to maybe include some of these homemade masks that could help them as well.
Okay, let me try to address each of those if I can remember them, Mayor. Thank you. As far as where masks should be worn, anytime you're in public and you may be exposed to the breathing or the area around other humans, it would be wise to wear a mask. I'm not wearing a mask because I am the only one in my office right now, and I do have an office that is separated. But if I were working in an office where there were other people close, or I were walking through like a clinic or where other workers were, or if I was working in like a clerk and recorder's office where there were people coming to the front desk, those kinds of things, absolutely, I would wear a mask. When I am out walking, if I am clearly away from anybody else, I would not wear a mask. If I was walking in a place where there were a lot of other hikers or bikers or whatever, I would wear a mask, both as a role model and for safety. I would be doing that. So I do not wear it when I'm driving in my car. When I get to the office, I go straight into my office, so I don't. But if I were going through a place where there were other people, I would put a mask on. You don't want to be taking off and on a mask frequently either, because that again increases the risk that you may have something on your hands and you may touch your face. And the most vulnerable spots in your body are your eyes, your mouth, and your nose. So again, when people go to the hospitals, they usually are given one mask now, workers, and are asked to keep it on all day long, not to take it off and not to be taking it on and off because of that kind of risk. As far as a second wave, I have not heard of a second wave as far as a second wave of the virus or a change in the virus so much as a second wave that may come if we let up on the public health order restrictions too quickly. Historically, back in 1918, it's interesting to look at 3 different cities, Philadelphia, St. Louis, and Denver. Philadelphia basically took a very laissez-faire approach, continued to have parades and groups and things like that. St. Louis was very strict and locked down with a stay-at-home order very quickly. Denver took a little while, but then got into a strict stay-at-home order. Philadelphia had very high rates of influenza. St. Louis had very low rates of influenza. Denver had low rates, but then they let off the restrictions much sooner than St. Louis did, and they had another wave of infections. That's what we're trying to prevent, is that second wave. And so right now, after we've sort of gotten a lot of this in place, a lot of the things we're looking at is, okay, how do we begin to let these restrictions up? How do we begin to open businesses again? What kinds of things have we learned that may continue to keep social distancing to a large degree in place, even though businesses can open up? That's what we're looking at to try to make sure we don't have that second wave. As far as the mask materials, again, there are websites both at the CDC and the Colorado State Health Department. I believe you can even link there on our website as to what materials can be used for masks. Essentially, you can use almost anything that helps to cover your mouth and your nose. You probably saw that just putting on a bandana also cuts down by almost 50% your exposure to anything that you may be exposed to in a population or in a room. There are some things that are much more efficacious. It was interesting to see that vacuum cleaner bags are very close to actually a surgical mask as far as their efficacy, but they also are very difficult to breathe through. And so trying to find the perfect material, actually it turned out to be something like a cotton t-shirt was probably one that helped to keep the virus out and also was fairly easy to breathe through. And that most people have available at home. And there are, I'm blanking on the word that you use for cutting it out and how to make it, but there are those online that you can find out how to make it if you want to. But just tying it around your head and face when you're out in the public will help to keep down your exposure.
Thank you.
Thank you.
Am I up?
Yes, ma'am.
Oh, okay. Doctor, a few questions came to mind as you were speaking. One is just the stay-at-home order seems to be getting extended out, and the schools just shut down for the year, that sort of thing. Realistically, what are we looking at in terms of stay-at-home orders being in place, and for how long? And I just wonder, at what point do we weigh, what other health effects go into place at that point? So for instance, people's mental health and not getting basic healthcare needs met. Say if you're elderly and you need to get a mammogram or something, but you don't want to go to the hospital right now. And then economic effects of people maybe not having enough food or crime and that sort of thing. And so I think people are just wondering sort of, what are we in for the long haul? I noticed today a headline about the convention, about the governor setting up 2,000 beds at the convention center, which I think kind of is an indication that we're thinking that we're not through the worst of this. But I don't know how long we're projecting the worst to be. And then are there, I think you've answered some of this, some of the things that we can make in terms of personal protective gear. I'm just wondering at the local level, are there things that maybe people could help with or make? And then how to coordinate our lobby efforts. I mean, if counties are competing, for instance, in Jeffco, we have a very high number of elderly people who are more at risk. So is there a way we can compete on that level with other counties for personal protective equipment and so forth? And then just a concern on focusing attention on enforcement of people not complying versus just full on treating people and trying to take care of the issue at hand. Do we really have the manpower for enforcement? Or do we need to just depend on people, most people, trying to do their best? Thank you, Doctor.
Thank you very much. You've covered a lot of ground there. I will try to address as well as I can some of the issues that you raised, beginning with the how long do we think this might last? A lot of modeling is being done around that, and as you know, no model is perfect, but some models are helpful. And what we're trying to do is find the models that seem to be the most helpful based on the information that we have, mainly from other countries, but also Washington State, San Francisco, and New York, some of the areas that have been hardest hit. What modeling and experiences can we learn from them as far as how long does a shutdown need to be in place? It's been a bit confusing because we have had continued or extensions of the shutdown, and we will. I am guessing, and now I'm speaking more as without the scientific data, but more as just guessing based on what we've seen. I am guessing that the extension that was just put in place today by the governor to, I believe, the 23rd or whatever it was that he said, will probably be extended again. I know the federal government has been talking about April 30. As we look at what's going on in the cases that we have right now, we believe that this week and next week, possibly the week after, are going to be the most overwhelming as far as new cases. This is based again on that incubation period being 2 weeks, and looking back as to the exposure and what was happening 2 weeks ago, we believe that we're going to be seeing a wave of cases this week, next week, and possibly into the third week or 2 weeks after this week. We are beginning to see in Colorado a drop off in the number of new cases. It's still going up, but it's not going up as exponentially as it was, which is a good sign. We hope that that continues so that we will continue to see more cases, but it will not be that exponential rise in cases. And that's the beginning of flattening the curve, as you've heard, trying to get it to the point where it then begins to come down again. And then, as I mentioned earlier, make sure we don't take things off too quick so that as it comes down, it doesn't go back up again. I cannot tell you exactly how long it's going to be. We worked with the school superintendent and the superintendents in the Denver metro region, and based on our modeling and also the fact that even if we begin to start taking off restrictions, places where large amounts of people congregate will probably be the last places that we take those restrictions off. And so schools and possibly even churches and things like that may be the last to have those restrictions raised, because so many people come together from so many different places and get so close together. So that was one of the reasons I think the schools went ahead and decided that they would not be opening up for the rest of the year, or the rest of this semester anyway. And why we are thinking that perhaps this is going to be extended a bit at least into late April, maybe early May, before we begin to see some of the drop. Some of the models that, again, like I said, they're not perfect, but some of them might be helpful. The one we've looked at here in Jefferson County makes us think that we may see the peak in new cases somewhere between April 17 and 23. And then things will begin to level off. Again, that means that there will still be new cases coming in after that, but hopefully it'll begin to start slowing down at that point. As far as the convention center, what we are looking at is two things. One is, where do we put people that have been hospitalized who are now beginning to convalesce, beginning to feel better, but still are not able to go home or do not have a home to which to go, and where can they go? And so places like around the country, people are looking at hotels and some long-term care sites, convention sites, like we are looking at, both for those that are convalescing as well as trying to be ahead of the curve in figuring out, okay, are we going to need to perhaps have some places where we need to be putting COVID-19 patients because we're overwhelming the system. As you may have heard, I believe it's the Javits Center in New York that would originally the federal government said it could not be used for COVID-19 patients. Now they're beginning to say they can, because the hospitals are being overwhelmed and they need a place to put them. So both of those kinds of patients may need a place to go, and the convention center is one of the largest areas in this region where we may be able to do that and still have some sort of separation between those who are ill and those who are convalescing. As far as lobbying, absolutely working together with the other counties and with our legislators from the Denver metro region is something that we are already doing, working with our Board of Commissioners and working with other elected officials to try to make sure that we are getting both the funding that needs to come to Jefferson County and any of the protective equipment that needs to come to Jefferson County. That is certainly something that is being done. It is unfortunate that we're beginning to compete with each other, because that's just going to drive up the cost, and it's going to make it very difficult for particularly smaller areas that are going to also need to get some protective equipment. But getting a unified lobbying effort would certainly be a helpful thing. As far as dealing with the elderly, that's a very touchy subject. Being somebody who is now elderly, it's especially touchy for me. But as you may have heard, the governor's expert epidemic emergency response committee came out yesterday with what are called crisis standards of care, looking at how should triage be done? What are the priorities that should be looked at? How do you determine who should get whatever is available first? That actually put a number, they said there were a number of things that should not be looked at, such as race and ethnicity and sexual orientation and gender and all of those kinds of things. But age is one that will be looked at. And again, it appears that if we get to the point where hospitals are having to make these crisis standard of care orders and putting them in place, that it will be looked at. What are the odds that you will survive this? What are the chances you would be able to come out of this and continue a productive life? And at that point, because of the way this particular virus is working, resources will go to the younger before they go to the elderly in some cases. I'm not sure if I touched on everything there that you had, council member, but I tried. If there's something else, please let me know.
Doctor, you're doing an incredible job, so thank you very much.
Thank you, Mayor.
Ramey?
Oh, thank you. Dr. Johnson, I realized I thought of something afterwards. I realize it's based a lot on an individual basis, particularly if somebody is on a ventilator. But do you have a feel for what the length of the illness is? And when somebody has had the illness, when they are no longer contagious?
Yeah, thank you, Councilmember Johnson. I appreciate that. A lot of study has been put into that, and looking at lengths of stay. This virus is an interesting and really almost a diabolical one, in that the course of the natural course of the disease seems to be different depending on a number of indicators. But one thing is that a lot of people feel miserable, then they start to feel better, and then they just crash. They get very, very sick, and then they start to get better, and then they either die or they continue to get better. And this sort of up and down in the symptomatology and the feeling of how well somebody is doing has been a real conundrum to deal with. What we're finding is that those who do need to be hospitalized quite often are in the hospital for a week to 10 days before they are put on a ventilator. And then they can be on a ventilator for quite a period of time. I believe the average, though, is about 20 days length of stay in a hospitalization, plus or minus 5 days. But my son-in-law, who is a respiratory therapist, is saying that they have people on ventilators now for much longer than they are used to, because people just the inflammation in the lungs is so severe that they just can't de-intubate them, get them off the intubation with the ventilator. And so it's hard to guess, but it's a long length of stay. And quite often it starts out not terribly bad and then gets bad, and then they're on the ventilator for quite a while. That does remind me of something, and I'm sorry I didn't catch the name of the council member before you, though, that I thought I probably should address. And that is, we are very cognizant of the fact that a stay-at-home order is not an innocuous thing, that it increases domestic violence, it increases child abuse, and it increases problems related to poverty, that people who are out of jobs have a higher risk of infections and of diseases and other things than somebody who is not out of a job. And so when we do something like this that is devastating to the economy and that puts people in confined spaces with other people, that it can lead to crime, it can lead to increased abuse, and it can lead to other problems related to things like poverty based on the economy. So we want to get off of this as quickly as we can without leading into that second wave of disease. That was why the way we're talking about this is almost, how do we shock the system as quickly as possible so that we decrease the number of deaths that we have in the long term, but also that we can get off of this as soon as possible by hopefully stopping the spread of the disease.
Dr. Johnson, I do have one follow-up question from my last one. It's my understanding that about 50% of the folks that are put on a vent do not survive. So the triaging is probably being looked at prior to the decision to even put on a ventilator. Is that fair to say?
Yes, absolutely. There is a lot of triage that goes on before putting somebody onto a ventilator, particularly in the areas where ventilators are already short. In some places around the state, it is not yet to the point where they are utilizing all of the ventilators. But absolutely, that is one of the things that goes into the formula for triage, is, like I think I mentioned earlier, what are the chances that this patient is going to survive even if we put them on a ventilator? And if it is determined that the chances are very low for one patient but high for another, the second patient will get the ventilator. So you're absolutely correct.
So Doctor, one thing that I've heard, especially from Chief Lombardi at West Metro Fire, is that, and you alluded to it earlier, when you have been exposed, and this very well can be the case for our police officers as well, that you have to go into the quarantine, mode for an extended period of time. And we talked about the lack of tests, one, but also getting the results back. And how do we speed up the results coming back so they know whether they have it or not and can get back to work?
That's an excellent question, Mayor, and that's one that we have been looking at. I actually just sent an email to copied Chief Lombardi on it about the issues around testing and how long it's taking to get those test results back. The whole arena of testing has probably been the most frustrating part of this whole response for a number of reasons. And I don't want to get into all of the decisions that were made that may have been based on politics. But what has happened was originally all of the tests had to be sent to the CDC. They were the only ones that had the reagent. Then reagent was sent out to the state laboratories around the country, and the state laboratories were doing the tests, but they had to be confirmed by sending them to the CDC, which again adds time. Then they determined that the states were doing them adequately and they did not have to get the confirmation by sending them to the CDC. And so the state labs were doing all of the tests. Our state labs are excellent at what they do, but they are not as facile as hospital labs and private clinical labs in dealing with things like electronic health records and linking patients to those records. And so they took a lot more time than, say, a hospital laboratory would in getting the results back. We are now, and I knock on wood that this is true, but we are hoping that we're seeing a light at the end of the tunnel. We have many more tests available now, both at the state laboratory, and we have more sites that are doing the testing. A number of the hospitals now, the hospital laboratories, have the platforms on which they can do these tests, and they have a larger number of tests they can do each day. We also have the private laboratories that are doing yeoman's work in getting the ability to do these tests and getting the results back. And we are beginning to see new kinds of tests which are quicker, so that instead of having to send them to a laboratory, you can actually get a report right in your clinic, in your office in 10 minutes, in some cases 45 minutes in others. And so those now are beginning to hit the market. As they begin to get more frequently in the market, we're going to be able to do those tests quicker. They're also, all of the testing up to this point essentially has been done looking for those viral particles. And now they're beginning to get some tests. Last week, I think last Thursday, the FDA approved the first serology test, which now is looking for antibodies. And so hopefully that company will be able to get those out, and that very quickly can show if you have antibodies to this, so that if somebody who is a first responder can show very quickly that they do not have the viral particles, or that they have antibodies to this, that they have already gone through and are supposedly, hopefully immune. We still don't know how long that immunity will last, but at least initially for a period of time, they'll be immune. They can get right back into the workplace. So absolutely, this has been frustrating. Absolutely, this has been a very terrible testing experience up to this point. But we're beginning, I believe, to turn the corner, and we should be able to see those results coming back quicker. Again, it'll depend on which lab. If you get a test and it's sent to the state health lab, that will probably take longer than if it's sent to Quest or LabCorp. But that variation should be getting shorter, and we should be getting more uniform quick tests out there.
Thank you. Ramey?
Okay, hopefully this is the last time. Dr. Johnson, you alluded to about 8 different strains. Is it possible that you can get the disease with one strain, recover, have positive plasma for that, and then contract it all over again with another strain?
Yes. unfortunately, and I only know of sporadic individual case reports from China where they did have people who had contracted the disease, had recovered from the disease, and then within a week or two came down with it again. And their belief was it was a different strain. So yes, theoretically that can happen. Hopefully, and this sort of ties in with what our experience with influenza is, hopefully, if you have had one strain and you have antibodies to that strain, your illness the second time will be not as severe and your convalescent period will not be as long because of some cross reaction between the antibodies you have and that new strain. It's not a, I mentioned earlier in influenza, every now and then we have a shift where we have a total change in the viral load in the virus. And that's when we have things like the pandemic of 1918 or the one in 1967, where we had huge numbers of cases because the virus had changed so much. What we're hoping is it's more like the drift that we see every year where it changes a little bit, but if you've been immune or you've been exposed before, you have some reaction to it and you don't get as sick. That's what we're hoping happens, but it's too early for me to say on all 8 strains whether there have been any shifts to such a degree that it actually has absolutely no immunity. As I mentioned somewhere along the line here, also, we don't know how long that immunity lasts. It appears that it will not be lifelong immunity, but it also appears that it should get you through the season anyway, and hopefully maybe even give you some immunity the next year.
Right.
Thank you.
That looks like all the hands that were up have been covered. Are there any final questions for Dr. Johnson? And we can hopefully maybe get him home if you do get home at night. All
That's
right.
where I'm headed.
Okay. Well, again, thank you so much. And I know the community really will appreciate this opportunity to view this. And we're just here. We're with you, whatever we can do to help support and make sure that we come through this soon and with the least amount of health impacts as possible. So thank you, Dr. Johnson.
You're most welcome, and thank you. Thank you, Mayor Paul, for all of the support that you have always given to us. I also want to thank your city manager and the staff. They have been very supportive and it is very helpful to us. So thank you.
Okay, well, get home and good evening and try to relax a little bit tonight.
Thank you.
Thank you. Okay, so as we continue, as I mentioned, we did remove item 4, which was the Metro District presentation, and that'll move forward to a different day when there can be more public engagement. Prior to this tonight, we had what we call a workshop, which we have from time to time, and that was to go over our council kind of goals for 2020, which were set at our planning retreat, which was pre-COVID-19, so pre this whole time that we're in. And an opportunity, we didn't have that live, but we'll make sure that that is posted with notes as well as with a recording of what was discussed. And just to refresh the community, the goals that came out of the council planning retreat were long-range funding strategy, economic strategy, homelessness, affordable housing, sustainability, and transportation safety. So it was discussed. We did a check-in. Some of those are still prudent to where we're at and things that are going to be ongoing. However, we've shifted to really a full COVID-19 response mode. And what that discussion looked like was what is the city's role as we proceed? What should we be doing? And there were 4 things that fell into play as to what we're going to look at moving forward temporarily. And again, some of those goals we mentioned are still going to continue to be worked on and in play, but the main focus is going to be COVID-19. It's going to look at lobbying. You've heard a little bit about what we can do as a body to better work with our other elected officials to bring the resources we need, whether that's medical, health related, as well as dollars. The CARES Act distributes those dollars directly to the county. in our case, because the county's over 500,000. So we'll need to be working with the other cities in the county to look at what those dollars look like. So a continued and enhanced lobbying effort by the city council. Also looking at what type of community grants could be available. We have a community grant program that was established some time ago, and that deals with nonprofits. And so there was consensus given, no votes taken, consensus, and council was divided on this in that what it looks like, as well as the format that we were discussing this. But direction was given to staff to look at our community grant program and to look at potentially increasing that, to look at a second round, and that second round would engage those nonprofits that are directly focused on the COVID response. And a caveat also was mentioned that those would need to go to services or goods being provided and not necessarily the staffing used to do that. So that will certainly come back to council for a public hearing or public vote. But that direction was given. And then what about our business response? What does that look like for 7,000 small businesses or businesses within the city of Lakewood? And so we certainly don't know everything and don't pretend to. So we're going to go out to those business leaders in the community, to our business organizations, and try to better understand what they see our role could be. And that'll create further conversations down the road. And then communication, utilizing our channels and our enhancements as how do we get the word out? For instance, the Action Center needs regular volunteers desperately. Other organizations might. So making sure that we're communicating effectively and trying to bring information to the masses that we can. That's the outside facing. The inside facing, of course, has to do with Ms. Hodson and her staff and the running of the city and realizing that we're seeing a drop in our sales tax. What does that look like for her operations? She has implemented a hiring freeze and will continue to monitor all of these aspects in regards to our sales tax. And there'll be a budget and audit meeting tomorrow as well that will make sure that we get that information out to council on behalf of the chairman, Councilor Beta, and they're going to discuss a little bit of this further tomorrow. So that was kind of a high level of that. We also had an update that at the April 13th meeting, we'll have a full functionality of public comment in real time. And so we'll make sure that that is communicated to the public. And last but not least, there is a request about our agendas and what do we look at as we move forward in these next few months. And the council, and we're going to continue this conversation, but was talking more about, moving things that really depend on heavy public comment, moving those off, looking at things that are purely related to the health, safety, and welfare of the city. And council, for this discussion and to help maybe give direction, in the email that went out on Friday, we talked about, is this critical to public safety? Can it be delayed? And what is the impact of the delay? And maybe those are measurements that Ms. Hodson can use as we look, because there is still going to be city business that needs to take place and things that need to happen. So what direction do we give her going forward with that? When we look at updates like sustainability or other presentations, do we want to go forward with those? And certainly there's a discussion about executive session. Those are a little bit more challenging to have. Can what executive sessions we would have on the agenda be delayed until we're able to meet again live and in person? So with that, council, I would open that to you, to any of your comments as we move forward. Dave? Let me go ahead.
So I'll echo what I said earlier. I do believe, and what you said, Mayor, what I have been referring to is kind of this philosophical legislation that we've talked about that came out of our February session. Things that are on the calendar now that do require a lot of heavy public comment. I think that those, by and large, aren't the pressing issues, and that we need to move those to a date in the future. And that right now we need to be focused on two things. And that's making sure that the operation of the city goes forward unimpeded. So we're tackling those things that need to be done for the safety of the residents. And then two, addressing those short-term priorities, those 4 priorities that you had listed at the top, using the meetings and the limited time that we have together as a body, using that time effectively and using it to help people, and not discuss endlessly and even aimlessly about topics that aren't dealing with the emergency that's in front of us now.
Thank you. Sharon?
Yes, I agree with that. The only thing I need a piece of information on is, are we okay postponing the executive sessions and pushing those out? I know what they're related to now, and I just want to make sure that we don't get into any issues if we postpone those. Kathy may have more on that.
Ms. Hodson, give me one quick second and I will unmute you. The floor is yours.
Okay, thank you. So as it relates to the executive sessions, we really just have 3 that are coming up. The real easy one that we can move off is scheduled for May 11th, and that is the streetlight discussion. That isn't necessarily time sensitive, and that can be pushed to a later date that doesn't have the urgency of our current situation. The other 2 executive sessions are 2 reviews. One is your city manager review. Here it is, city manager annual review. And the other one is your city attorney annual review. Those are dictated by your policies and procedures. If you're so willing, there's a way I'd like to recommend we go forward. I also agree that an executive session by Zoom doesn't really work very well. And I can speak for myself. I've been working on my annual report. Typically, I complete it, submit it to you. You fill out an evaluation form. Each of you submit it to the mayor, and then we sit down and have a conversation about the report and about your the evaluations that you fill out, and you give me your feedback. Another way to do that, if you're willing, is I'll submit the report. It's almost complete. The mayor, in conjunction with the HR director, will, after that, he'll send the evaluation forms, and we can do this without the executive session. If you want to have an individual conversation with me, if you want me to set up 11 individual conversations, I can sure do that. I can do 2. Let's see, yeah, I can do 2 at once without making it a public meeting, however you want to do it. But we can still move the annual report forward, and then you fill out the evaluations. What we really can't do is the meeting where all 12 of us sit down together.
Thank you for that. Anita?
I just wanted to just thank Kathy Hodgson and staff for listening to a lot of my suggestions at the last meeting that had to do with, for instance, tabling our normal agenda to give more attention to the COVID-19 issues surrounding the crisis, and also, you know, concerns about spending any part of our budget when we don't know what kind of dire economic straits we're going to be in going forward. And so I'm hearing some attention to that, as well as that Ms. Hodgson came up with some ideas about voting going forward. And just during our session prior to this, we were talking about concerns about voting on issues without public input and whether we're violating open meetings or democratic principles. And so then we attempted to do a vote on Zoom by raising our hands on Zoom to give a consensus, and that went awry because I was trying to make a comment and it was being counted as a vote. And so then we talked about Ms. Hodgson's idea that we hold up a card as well in view that shows whether we're voting yes or no on a particular issue. And I think anything like that, any ideas like that that create transparency are important, especially in light of the fact that this is new ground, trying to hold virtual meetings and have public input. And I appreciate that staff is finding a way to do that, especially in the light of the fact that we have been both in the Denver Post and on the Colorado Freedom of Information Coalition. Well, there's been articles written about how different municipalities are dealing with that, and that we had not yet found a way to do that. So I appreciate all the efforts to try to, as we're protecting public health, also make constitutional rights a priority, because you can't have public health without protecting those constitutional rights and checks and balances on police powers. And so we got to make sure when we come through this that we still have all the freedoms that our forefathers fought for. And so anyway, I think that it's great that we're finding ways to protect our constituents, both health-wise and inform them health-wise, but also to protect their rights as we're going through this crisis. Thank you.
So does that seem, I don't have anybody else lit up. Does that seem like a reasonable direction for Ms. Hodgson? Or Ms. Hodgson, is that clear? I mean, I guess the one thing, it sounds like it's public health and welfare. I'm saying it wrong, but what do we do about the updates we had? Like, we have a sustainability update. Does council still want to see those sorts of things, or do we want to put those off? I mean, you know, those aren't technically actionable items, but to Dave's point, this is challenging for us to meet like this just because of the format. So do we want to use what time we have together to really be making, you know, decisions and things like that? I'm getting some yeses. So Jacob?
Yeah, I was just going to say, I mean, I think it makes sense that we just don't have a good sense of how long this is going to last, how long we're not going to be able to meet in a room together. To me, it makes sense for a lot of these things that aren't pressing to be pushed back as far in the year as possible or needed, depending on the issue. But obviously there's some of these other issues like funding, which is very pressing, and it's going to become more and more pressing as I think time goes on. I think that'll be pretty obvious, just based on some of the economic numbers. So I guess what I'm saying is things that aren't essential, we should probably just be delaying as far back as we can, and then pushing things out of the way that aren't necessary, and focusing on the issue at hand. And I think there's smart people, obviously, in the city manager's office and you, Mayor, who might be in a better position to make some of those calls. Just my thought.
Thank you. Mr. Abel?
I think that we need to concentrate on the health, safety, and welfare of our community primarily. And if something comes up that we have to deal with, we deal with it. Otherwise, I think we need to concentrate on the task at hand and dealing with this pandemic that has turned things upside down.
Thank you, sir. Ms. Franks?
So just to make sure I understand, it seems to be that what Ms. Hodgson kind of laid out as far as her sending out that information, I think that's part of the charter, we have some deadlines in there that has to be done. And it sounded like that if she sends it out, and then those of us who may want to, after we've done the actual kind of scoring system, we could certainly reach out either in pairs, like, Counselor Skilling and I, we could just simply reach out and say, hey, we'd just like to go over some things in more granularity. But it seems to me that's the right way. It still makes sure that all of that necessary information gets conveyed, where we see opportunities to provide kudos, and where we see opportunities where we might see improvement. But if that's how we could do that, then maybe it's sort of, since the city attorney office is in a unique position, but yet we have a hiring freeze and things going on there, that maybe we sort of work them the same way, since kind of we have to do those. And I believe that the deadline for the city attorney office review is the end of May. So certainly it may need to follow the same type of a track, but it has a slightly different flavor to it.
Well said. Anita?
Yeah, I just forgot to mention that I wanted to, I think 5G is one of those issues that needs to be pushed back on the agenda. And I have been hearing from constituents that it's possible to, in a public crisis like this, to put a moratoria on those applications. And so I really would push for that being one thing that we push off, because we have so many constituents who feel very, very strongly about this issue and need to be able to participate fully. Thanks.
Yeah, I think that goes to Dave's point. I think we all know the issues that we need to have the public engagement piece into that, and that certainly 5G is one of those. Ms. Hodson, go for it.
Oh, am I unmuted? Thank you. So I took a run at what might be suitable for projects and topics that can be pushed off to an opportunity where we can be all in the same room at the same time, having a conversation with the public. I am now convinced that local government wasn't meant to be done virtually. That's just a little side note. It's so hard, and it just doesn't have the same effect. So I took a run. It won't be perfect, I understand. On the 13th, we do have second readings, and they've been posted. So this all impacts after the 13th. On April 27th, we have the Head Start cost of living increase that I believe needs to go forward, as well as the CDBG consolidated plan that has an impact on our ability to receive funding. We can continue the small cell, the 5G, the second reading for the 5G and the fee associated with that. I haven't run this past legal, but I don't see why we wouldn't as we're in the middle of this emergency. Now for April 27th, the LRA meeting, that can be pushed off. Again, on May 4th, that's the city manager annual review. We won't be having that, at least not in this format. If you'd like, May 4th, that's a study session. We have a presentation scheduled, Economic Development Comprehensive Overview, that can be pushed until a time when we can all be together. We can have the public in the room and have a more robust conversation. So these are my thoughts. Push back. I'll finish and then push back.
On the one that you just mentioned, though, May 4th, that I might leave that as a placeholder, because that might be, if we have information on relief efforts related to economic development and COVID, that could be the place for that.
Sure, we can do that. But this is the one that was scheduled as a result of your planning goals. So this was the big, broad conversation around economic development. I agree with you that somewhere in here, we're going to need to replace with some COVID conversations. So May 4th also is a designation of the special counsel for the LRA and the board composition and possible expansion as it results to the state law. So we can push those off. Again, on May 11th, that's the executive session about streetlights. and that discussion about Excel, we can push that off.
So Kathy, we could probably stop there for now, right? I mean, the governor went to April 26th tonight. So we can reassess unless you need to continue. I mean, I think you have a pretty good idea from what you've explained of what we should be clearing. And if we go further than April 26th, then we should just keep moving those down the line.
Okay, so if you're comfortable with the way I looked at that and the recommendations I made, we'll just go forward. Will it be perfect? No. And if you can call something out that we've made a mistake on, let me know. Things are a little crazy as we're all really responding to the COVID. We're not all on deck physically. So there's just some complications and impediments, but we'll work on this and fix the agenda. Again, the 13th will stand as it is. And I agree that you should really be asking questions and look through the lens of, is this a safety and health issue? What's that cost? And what if we don't do it? What if it's delayed, and those kind of things? And we'll make sure to be prepared for that. So we'll change the schedule all the way through the executive session on May 11th, and then we'll just update it after that as time goes on.
So Councilors Gutwein and Beta, you both had the general business discussion question, which we kicked from the last regular meeting. Are you okay with moving that further down the line as well? Councilor Beta?
For the record, can you just state what those are again so everybody knows?
Yeah, so your request had to do with the blight designation and doing a modification on the blight designation. And Dana, I think your request had to do with, I don't know what it had to do.
I want to say wheelchair.
Yes. It's about wheelchair accessibility. I am completely fine with moving that down the road. I think that makes sense. Yeah.
Well, on the blight designation, I think that's going to be a very simple, I may be optimistic, but it's just a very simple modification to our already existing rule. So I wouldn't anticipate that it would take very much time. I mean, unless I'm missing something here, but I mean, staff's already looked at it, and it's just some minor tweaking of our existing blight rule. So I guess I'd be inclined to leave it unless it looks like it's going to take up a lot of time that needs to be focused on something else.
So my question is for Mr. Cox, you're on the phone. Does that take the form of an ordinance change or a resolution? And keep in mind, the request right now as it is for a study session. So it would be to move it towards a study session, which essentially we've just cleared everything. So I think while you might think it's an easy one, I'm not so sure as these things can grow hair as we go forward. But Mr. Cox, I don't know if we have you.
Is he muted?
No, he's unmuted.
And that's scheduled for when?
The 13th
of May?
No, April, next week.
Oh, okay. Well, if we were to go ahead and move it, well, how soon can we get to it again?
Well, I mean, we would look probably a month, look at May 11th, and sometime after that, we're hoping that the order is lifted and we'll be able to meet in person.
Well, yeah, if it is, I can live with that.
Okay.
I as I said, it's a study session. It should be fairly short. just don't see that it's that complicated.
Mayor, excuse me for interrupting. I just got a text from Tim Cox. Apparently he can't weigh in. He just said it would be an ordinance change. So for whatever that's worth.
We'd have to go through first and second reading.
Yeah.
Ms. Franks, maybe.
Well, this would just be getting the process started then.
Well, this
That's
would,
how it's doing.
well, the regular process would be a study session.
If there was, right, and the idea would be, is there a consensus to go forward with the changes that I proposed? And if there is, then we would go to a actual, whatever we need to do to rewrite the ordinance and then first and second reading. So we're still talking in a process that would take at least a couple of months.
It's considered a code amendment. So it would be for.
Yeah.
Mhm.
Right, but the thing that we have coming up is on the 13th would just be a study session and a consensus of the council whether or not to go with that proposed amendment or not, right? That's the process that we followed.
To move it to a study session, and I guess keep in mind though, we're gonna then be recreate, I mean, we gotta recreate a lot of agendas. So, I mean,
Well, I guess I'm not hearing good reason to continue it. I guess what I'm saying.
well, I mean, I guess I would say, does it have to do with what we just talked about, the health, safety, and welfare of what's before us right now with COVID-19?
No, it does not. I'm saying that that's the only thing we're going to address for the foreseeable future is COVID-19 only.
Yeah. Or things that besides the second reading, which council on Monday night can postpone further. Kathy's pretty much cleared the schedule, except for what she's seen as things that we have to take care of.
Well, I'll go along with it as a team player as long as the rules apply across the board. So in other words, if I'm going to go ahead, this initiative, which I've proposed some time ago, if we're going to move that down the road because it's COVID-19, it's not COVID-19, but I want to make sure that rule is going to apply across the board.
And Dana's has been in the queue for a substantial amount of time as well, and she's moving hers down the road as well.
Okay.
Barb?
Thanks, Mayor Paul. I just wanted to kind of piggyback on that. Certainly just a reminder that we have those multiple forms, and one of those forms is for a legislative modification. So Councilor Bida, in my view, and maybe I'm kind of oversimplifying this, but if it's really just language changes, I don't see anything that would prevent you from looking at the ordinance as it is, kind of determining what you would want to do to change that, putting in a request for modification. It certainly would still need to go through the two processes, but we maybe could bypass the study session. You could be, while obviously we're focused on COVID, certainly you could run that on a separate track and then just take it through the legislative modification if it's fairly minor. Obviously, if it turns out that it's a wholesale rewrite, then certainly I haven't looked at what you proposed at this point, but just wanted to make sure that you know that there's other avenues while we're staying focused on the immediate need. Certainly all of us are working on other things as well as time permits. So just wanted to throw that out there while we were kind of all on the same call together.
Well, we've already done that. I've already proposed the language changes. They're very minor. They've already gone through staff and they've looked at it. So it's all that track. It's already on that track you're proposing, and well, it has been since the first of the year. So
but
this
what
was
the request for a study session then? I guess I'm confused. It says that the request was to go to a study session. Yeah. What would we be doing?
Because it came in under our old process before we before we had moved into this new one.
Okay, got it.
Which is certainly fine, Councilor Bida, and we can shift that into that format. It'll just be a matter of, again, it'll still be, it'll still be pushed out a little bit until we get back to normal business.
Well, the thing is, this does have some priority because it's not just, I mean, there are other things that are going to be affected by what we do here. Ongoing development cases and so forth. So it's something that it's in the regular course of business. It's not COVID-19, but it's been on the radar now for some time now, for since January, and I just don't want to put it off indefinitely because I do think it has to do with the normal course of our business for the city. And while I agree we want to make COVID-19 top priority, but we are going to have to do some business as usual, and this is one of those things.
Yeah, no, I certainly agree. And keep in mind, anything that relates to the modification still would come to council in the form of, if somebody was seeking a blight designation, which you're trying to change a little bit of that language, that still has to come to the body. So nothing would go past this body either way without this change going into place.
All right.
I have Jacob and then Sharon.
Well, if we're moving on, then I don't need to add any comments.
Okay, thank you.
Thanks.
Sharon?
No, me. No. Do I need to unraise my hand?
No, I did it, I think. All right. Ms. Hodson, you're still off mute. Anita, go ahead.
Yeah, I thought of one more question surrounding the 5G issue. And I wasn't at the executive session where we sort of lifted the pause. But my question would just be, if we're not addressing 5G, what's going to happen with regard to applications coming in and not having city resources to be able to really deal with that right now? So do we need to look at on the 13th another look at that in some way, or are we just not processing applications at the moment?
That's a really good question. Nobody expected, of course, this emergency, so we really have to figure this out. And I don't know if you saw Ken Philman's been, otherwise he's been stuck on a cruise ship, which is just another conflict. Yeah, he was. Yeah. So anyway, Ben, can you take a run at answering this? He's muted, Mayor.
I know.
All right. Can you hear me?
Yep.
Okay. So based on the direction from council, we are continuing to process applications under the old rules. So none of the new rules that were being considered are put in place. But because of the pending legal action, what council did was said, yes, staff continue to process applications. So that's what's happening. I don't know. I haven't talked to the planning staff at all about this in maybe 3 weeks or a month. So I don't know how many applications we've had come in, but my guess is, like everyone, the wireless industry is also probably in this holding pattern with COVID and trying to protect their employees as well, and also trying to figure out what their revenue picture looks like. So I don't know. I haven't heard anything that we've had a flood of applications though. But if you don't address anything on the 13th, the rules won't change. We won't have new rules to govern them by. I'm not proposing that this is critical or needs to be addressed on the 13th though.
Well, we don't have it. We don't have it on the 13th.
So I mean the 27th.
No, the 27th. Yeah. Mr. Abel?
If I recall, what we actually voted to do or decided to do was to go ahead and process applications, but any that were any applications that are approved would be subject to the new rules that we're going to pass later, not the rules that are in place now. Is that correct?
We still had to comply with the shot clock and all sorts of other things.
So if we do this, then this way, we're just throwing up our hands and saying, go ahead and do what you want for now. And, you know, if we get built out, we get built out. I don't think that wasn't my thought when I agreed to delay this thing and require, as Mr. Feldman said we could, that anything that's approved be under the rules that we pass later, under Mr. Skilling's idea of pendency.
I absolutely agree with you. I think if what Ken said was that if we have the shot clock time to apply the new rules and council takes action, we can't retroactively apply rules. If someone's given a permit, we can't retroactively say, no, you actually have to comply with these new rules.
Under the pendency doctrine, we apparently can. That pendency doctrine has been cited before by the city of Lakewood and.
Well, that would be a question for Mr. Feldman. I mean, my recollection of that conversation was if someone's granted a permit, then they're granted the permit under the rules they're granted the permit. We can hold it as long as we can and say that, hey, your application came in before council adopted the rules, and we plan to apply the rules that council is considering to your application. But if an application is in the process and has to be granted a permit, I don't think we can retroactively apply the rules. But again, Ken or Tim, if we can get him, would maybe be able to speak to the legality better.
And I don't believe that your concept of this, it was our intention when we voted.
Mr. Abel, you didn't vote for this. You were the no vote on it.
I understand that, Mr. Mayor.
Yeah, though I think that's important though.
No, I don't think that's important at all.
Well, no, because you stated that the reason why you supported it was because of this, but you didn't support it. But I'm gonna read this, and I don't want to get us hung up on this tonight, but I will read it. It says, all pending or previously approved applications after August 10th, 2019, as well as all new applications must comply with all applicable federal, state, and local laws, including Lakewood's pending ordinance 0-2020-1, set for second reading before the City Council on April 27th. Recognizing the issues of potential modification to that ordinance discussed on February 10th. Such applications must also comply with any requirements imposed on a specific site by the National Environment Policy Act. Recognizing that all applicants represent in writing that they will comply with all state, federal, and local law, city staff is directed to review each application and ensure that applications are in compliance with applicable law, including without limitation the pending ordinance. So that would read to me that something does need to be on the agenda for the 27th to extend this, both of these orders, because that's what this says is the 27th. Without having our legal team to advise, I think that a consensus to advise a recommendation on the 27th is what we should proceed with, whether we have to extend both of these or just one of these or what. Ms. Gutwein?
Thank you. If based on the language, we need to have an additional meeting or have this on the agenda, then I think that's fine. However, I do think that just kind of this last piece of the conversation is showing us why it's so important that we all stick to the original piece of this, our night's discussion, which is we are going to focus on COVID-19. We're going to focus on our response. That's what we're going to put our efforts into. And, you know, I really appreciate, for example, Councilor Bida being willing to delay his proposal and be the team player. And I think, you know, this is not a topic that was on our agenda tonight. I don't really want to be having a long conversation about 5G right now.
Just to put council's mind at ease, our ever dedicated staff did email me and they said we have one application that came in that they have been holding on. So we've only had one application come in since your last discussion on this.
Thank you. Ms. Johnson?
Thank you. I don't want to extend the conversation either, Dana, but I think there's a little piece of clarification that I need to have. Adam, after you read what you read, it was my understanding that any applications that we accepted would be held to the standard of the new ordinance that we would be dealing with. And so to me, that was one of the reasons I was willing to go forward with it, because they would be held to that standard. And I believe I read today that if there is an emergency status, then a city can put a moratorium on accepting new applications. And I guess I need to make sure that that is correct. And I appreciate knowing that there's one there, and it sounds like we're just kind of putting it in a holding position for now. I appreciate that.
And unfortunately, we don't have our telecommunications attorney to be able to answer that, but I think Ms. Hodson can take this conversation. We can try to get answers to this. And again, there's one pending, so there you have it. Mr. Abel?
We have one application for how many units?
I don't
How
know.
many? Pardon?
I don't know. All I know is that we have one application.
One
we-
application could be 5 units, it could be 500.
Certainly it's possible that there
Devices.
could be multiple sites.
Thank you.
Ms. Springsteen?
Well, I think it helps to know that there's only one application, but it is a concern what effect that has. And I do think this is a health, safety, and welfare issue. We have been working on coming up with suggestions for changes to the ordinance. And if we can't proceed with Mr. Fellman because he's unavailable, it makes things difficult with regard to the 27th. But I guess my understanding of what was passed is that everybody will be subject to the new ordinance. So I just want to clarify that. And two, if we maybe just address on the 27th that there's an extension of that, I think maybe we accomplish what we need to. We don't need to put a lot of energy into this at this point since we have other priorities, but it is sort of fallout of the health, safety, and welfare issue. So
I appreciate that, Anita. I think we certainly can have legal, whether Mr. Fellman's available or not, somebody will be available to help better answer. And if there has to be something that's actionable on the 27th because of our resolution as well as the extension on the ordinance, we can certainly do that. And I'm seeing Ms. Hodson weigh in.
Yeah, thank you. For some reason, we're only getting correspondence from Tim through text. And he did tell me that they need to look into the emergency situation and just check that out. So he will do that. And I also saw on the news that I think the Fellmans are are on their way back to the state. So remember, this is April 27th. So that hopefully that gives them ample time to get back home. And I think he must have had the 27th on his calendar. So we can check that too. And so how about if we leave this with, if you'd be so willing to direct your city attorney to look into the emergency situation and the opportunity, if that's the opportunity, to do a continuation, and he's listening to this conversation and he can follow up on all of this in writing to you. Does that sound fair?
And I also I got confirmation it's a single site on that single application. So
Okay.
one site.
Thanks, Ben.
And he just agreed that they would do that they would provide a written summary. So a little weird doing it this way, but he's with us somehow.
All right. Let's go into, is there anything else on the agenda setting, anything else? Okay. I want to go to reports. Ms. Hodson, do you have anything? I know you didn't probably have anything planned because we don't normally, but go ahead. I'm sorry, I had you muted. There we go.
Only that we're spending a lot of time on budget and the impacts of this virus on budget. We're also trying to push out as much information as we can to you so that you can share it with your constituents. I always know that whatever information you get, please feel free to push it out however and wherever you want to. Yeah, we're just all just trying to keep going and keep the business of the city afloat here. So
Thank you.
all right. Mhm.
I'll start at the bottom of my screen. I have Dave. Do you have any reports? No reports. Ramey, do you have any reports?
No report.
Okay. Charlie, do you have a report?
I'd like to report that I think staff is doing a really good job. They're working really hard, long hours from everywhere across the city, including their own homes. And I think we all owe them a thank you.
Thank you. Thank you.
Jacob?
Yeah, I just echo what Councilman Abel said. Thanks to staff for all the work that they're doing. I know some of the work that's happening at home. You know, as many of you know, I work for the city of Denver, and I've been working a lot of strange, weird, long hours trying to do some of this stuff from home as well. And so I've seen some of what that looks like. So I know it's not easy. So thank you for all the hard work you guys are doing. And also just want to mention we're going to do our first attempt at a digital town hall ward meeting on Wednesday. Hopefully we don't get a lot of complaints. We'll see. Hopefully some people will be able to find the link. It's on our website, on Lakewood's website. So hopefully you can get in there and give us your feedback, and hopefully we have a good meeting. So thanks.
Barb?
Thanks, Mayor Paul. Wanted to follow on Councilor LeBure's report that we are also going to this Saturday be trying a Zoom meeting that went out with our newsletter. City has it posted. Please be patient with us. It's going to be a learning experience. Certainly wanted to echo what other people have said. Staff has been absolutely amazing, taking a lot of our forwarded emails that we get from constituents and responding in a real timely manner. So really appreciate that. Appreciate the depth of the information available on the website. This is a difficult time. And most of all, I really wanted to just speak out to the community and say thank you all for everything that you're doing for one another, checking in on your friends and elderly neighbors, obviously remotely, and just making sure that people have a connection who might be homebound. Thank you for your generosity, people making masks, digging into their own supplies and donating to these drives. Just keep an eye out for everywhere that you can help your fellow citizen, and we'll be here doing our part trying to connect you to that information. Thank you.
Thank you. Sharon?
Sharon?
Yep.
Oh, sorry. I thought Karen's not here. That happens to me a lot. I can't even believe I'm going to say this, but I think I'm really looking forward to a Monday meeting where I can sit in between Charlie and Dana and have contact. It'll be nice to get back with everybody together. And I also too appreciate that not only is staff stepping up to the COVID issues, but the quick responses we're getting on other things too that are issues within our community. They're right on it, and that is greatly appreciated.
Thank you.
Mike, let me unmute you. There you go.
Thank you, Mayor. I'd like to just take a minute and address our constituents from Ward 3. And just to let you know, we are still working on trying to come up with an alternate format for a ward meeting, a town hall meeting for April. Right now, we have no place to hold it because the Phillips United Church has closed down for the month of April. So we are looking into some sort of a virtual type of town hall meeting. I want to see how things go with Ward 4, with their experiment, and look at other options as well. But we just wanted to let our constituents know that we certainly haven't forgot about them or anything. We have decided to kind of stand down a little bit because we know that there is so much information out there coming from the news media, the national level, the state level. Our city website has an awful lot of information on the virus. So we really don't have a whole lot to add to that. I think those are the experts. And so we want our constituents to know that, we are engaged obviously with right now the issues of managing with the city. And if you do need to contact us anyway, you know how to do it. For me, the best way is through the mbeta@lakewood.org email. So that's all we have to say, and we'll try to let you know if and when we can come up with a virtual town hall meeting. Thank you.
Dana? There you go.
Okay, thank you. We had our first Ward 5 virtual meeting that we put out last Saturday. The way we did it was we had a Zoom meeting between myself, Councilor Harrison, and we had Sergeant John Alish. We had asked him months ago if we could have some of his time that morning to talk about just what's going on with the CAT team. So he was able to still make time for us, which we really, really want to thank him for that. And it was incredibly informative. And I just want to tell you all a couple of things that I learned from talking to him. One was, I know all of us have been concerned about our police agents and exposure. He told us that the Lakewood Police Department has full PPE and that we have some of the best actually across the nation. So I feel really proud of that our agents have what they need to stay safe. The second thing that I thought was really interesting is we asked him how 911 calls are and in terms of capacity, if they're seeing just an overwhelming number of calls. And what he said is that because traffic accidents are down and traffic calls are down and that kind of thing, that there's a decrease there. And even though there's an increase in symptom related calls, there's an overall decrease in 911 calls right now. So I thought that was really interesting that you might all want to know. And finally, we also asked him what the number one thing that we can all do to help is. And he said, stay home if you can, and not just to keep us safe, but also just a reminder that we're also doing our part to keep our agents and West Metro Safe. So we took questions by email and text message and phone call ahead of time so that we could answer them during our video. It is definitely not perfect, but we tried to do the best we could with what we have, and we got good feedback. The link is still available if anyone would like to see it as you're preparing for your meetings coming up. So thank you, and a huge thank you to our police department and all of staff.
Thanks, Dana. And maybe if other council members have questions, you and Karen can help as they plan out their meetings. Anita.
I just wanted to say how proud I am of so many of the constituents in our community who have worked so hard, not only to keep our community safe and to try to do the right thing, but also people who have been activists in the community in terms of getting the word out there that even in these dire times that we need to think about our Constitution and our laws and how protecting public health also depends on protecting our Constitution and our liberties. And so it can be a scary time when a lot of it feels like those liberties are being taken away at all levels of government. But if we continue to speak out and make sure that we're heard by our leaders, I think that's incredibly invaluable, and in the long run will lead to a better path out of this crisis. And I also wanted to mention that some constituents have worked really hard on this 5G issue, and they're having a technology webinar with Dr. Sheckley on April 11th from 1 to 2. I believe that has been set, but I'm not quite sure how to patch in. So if people are interested, please get in touch with me about that. And to just express one concern that I hope, as we're trying to protect all of our public officials here, that we work hard to try to inform each other if there is any kind of exposure. I know for myself, when I went to DC and I had exposure to some people with COVID there, I did not find that out immediately from anybody in the city, and so could have exposed other people. And I just hope that we're very careful. And I understand there's a lot of confusion right now, but I think we can learn from that and going forward, make sure that we let each other know when we're in that situation. So thank you, and stay healthy, everybody out there.
Thank you. All right, so I'd echo a lot of what everybody has said, and as we talk about and we look to the future, it's going to be challenging. And you heard Dr. Johnson talk about the peak is not going to be here for another 10 plus days, in his opinion, right? So we need to continue to work together and just realize what everybody's going through, and that kindness that is all within us, not only on screen, but off a screen, right? So whether we're thanking staff here, but also when we deal with staff in the day-to-day and really trying to understand what they're up against. And I've really learned a lot, and I've had to readjust what I've always thought was important in different ways, somewhat meaningless now. This is what's important, is what's here and in the now, and getting our community healthy, getting us back on track. I get these letters now daily. This is 3 that came in with the last couple of days. Those are layoff notices. And in those 3 letters is almost 500 layoff notices of businesses within the city. And those are just going to keep coming. Foothills Foodies serves, I think, around 200, Barb and Dave, and they were up to 800 people. The Action Center doubling, tripling those needs. Charlie was trying to help somebody who's in a motel situation and wondering what that future holds if they were to be forced on an eviction. So all these things are coming to a head, and the best thing that we can do is continue to work together as a team. I'm really proud of this council, but I'm proud of our staff, Jonathan and the communications team who's been trying to get this figured out. Ben, you've quarterbacked a lot of this. And, you know, I was wondering why you were wearing your mask all day, aside from because we're supposed to, but Dr. Johnson said, don't take it off. Hats off to you, Ben. I learned something here today. So as we move through this week, and Easter for some people who celebrate Easter is on Sunday, and just really take this time to realize what's important and know that we are going to be tested. We're probably going to see some failures in our system, but we're going to learn. We're going to learn from that. We're going to come out on top, and we're going to be better for it. So thank you all very much. And thank you for tuning in to this virtual meeting. And we do look forward to when we can finally meet again and enjoy the company of one another. So blessings to you all, blessings to our community. Thank you.